My name is Becky Haas. I am a national author, trainer, and speaker on the subject of trauma-informed care. I first started into this topic in 2014 while I was working for the Johnson City Police Department. My job there was to reduce drug-related and violent crime, as well as develop an intervention to reduce recidivism. And it was in that journey that I first heard about the Adverse Childhood Experiences study and how that childhood trauma has a significant bearing on future life and health outcomes. And so through that opportunity, I partnered with Dr. Andi Clements, and we began to train professionals in our town. And after we'd trained about 4,000, SAMHSA representatives came, the Substance Abuse Mental Health Services Administration, as well as two first ladies and people from 20 states, and said that we had created a model that other cities should follow in dispersing this information. And so following that, I was offered a role to work at the healthcare system here locally, to be their first trauma-informed administrator, to help them as a health system raise awareness of childhood trauma as a social determinant to health throughout rural Appalachia. And now I'm pleased to be serving as a consultant to the StrongBrain Institute. So we welcome you to hearing more about the StrongBrain Institute as we share.
I'm Andi Clements, and I am a faculty member at East Tennessee State University, ETSU, in the psychology department. Been here 26 years now, and have, as Becky said, started to do work around trauma-informed care and ACEs. In 2015, we held a large conference, invited people from lots of sectors to that. I also led my students to begin doing research in that area, and in the meantime, began looking at ACEs and past trauma in relation to addiction. And most of my work now is in addiction and working with the faith community. I work with a nonprofit called Uplift Appalachia, and our mission is to mobilize churches to address addiction. But through that, we also do a lot of trauma-informed care training, particularly from a faith-based perspective. And through our work at the university, several of us began, many inspired by some trainings that Becky and I did early on, to get into this work around ACEs and trauma-informed care. And so that's one of the things that we mainly want to share with you today is our work that has become the StrongBrain Institute. Ballad Health is a large healthcare organization in our area, and that Becky had mentioned that she has worked with to be their trauma-informed administrator for a good while before launching out on her own. And they saw this need and partnered with ETSU and funded the start of Institute that was formed. They gave a gift last spring, and then the Institute was launched in June of 2020. This is a collection of many faculty here who work in the area of ACEs and trauma-informed care. We now have 16 faculty, 2 associates, we have staff. The faculty represent 11 academic departments, which represent all 8 academic colleges at the university. So this is, I'm sure, the largest multidisciplinary effort that has ever happened at ETSU. And so we want to tell you some of the things that we are up to in that. And so one of the things that we do is we consult with organizations to create culture change. And that is a lot of different types of organizations. One of the first projects that we launched was working with our College of Pharmacy. We received an internal grant from ETSU to try to trauma inform an entire college. And so this is a College of Pharmacy. It contains 2 departments. And so for the past year, we have been working to train and coach faculty, staff, administrators, and students in understanding effects of past trauma, ways to address that trauma, and so forth. And so we're developing a model that hopefully other higher education institutions can use. We also are interested in consulting with K-12 education, social service organizations. I mentioned earlier, faith-based organizations. And eventually we would like to get into even working with businesses in the area and so forth to help them understand what the best practices are that can create some of that culture change. Another thing that we do is we are a research center. And so we want to conduct research that will verify what the effective ways to promote resilience, to reduce the effects of ACEs, mitigate those effects of past ACEs, and so forth. So we want to be able to verify what is effective, what is not effective, and so forth. We also want to help others and ourselves to evaluate programs. So we're developing instruments and validating instruments. Right now, we're working on one that it can be used in higher education, but also help folks that are currently doing these endeavors or want to launch into them, how to design evaluations to verify their own effectiveness, so forth. And then we want to publish research so that a lot of these fantastic efforts that are going on are being shared so that others know what's happening. Because if we do it, it's great if we know it, but we also want to be sort of that repository for information that others can use to implement in their own areas, and we can have confidence in what those effective methods are, and we would like to be able to be a resource for people to do that. Becky is going to talk some about our policy consultation.
All right, thank you, Andi. I'm involved as a strategy member of the National Trauma Campaign, the Campaign for Trauma-Informed Policy and Practice, CTIP. They have been around for many years now, and so the National Trauma Campaign comes up under the CTIP board. And so what the work I'm doing at a national level is this campaign was launched in 2020 as well during a pandemic, and we have garnered 500 individuals across the nation, probably over that now, that have signed up to be what we call local liaisons. And so the strategy team that I'm part of, they're very involved in policy and legislation, the CARES Acts that have come down through the federal legislation during the pandemic, and becoming aware of where those funds are and how to help coach the liaisons across the nation on how to reach out to legislators about embedding trauma-informed policy and practice into schools, into healthcare, into policing. And so in my role, serving in the StrongBrain Institute, I have worked to help the StrongBrain Institute step in more to the national level arena. We were super excited to have been on a January CTIP call. Every month, CTIP hosts a call of kind of Ask the Experts. And in January, the StrongBrain Institute joined Oregon Southern and Florida State University in the call, and to talk about what's going on in higher education. And following that event, it was decided, Dr. Wally Dixon, the founding director of the StrongBrain Institute, and I had a conversation, and we had committed to host a convening of universities and colleges. And so we were real pleased that in March, we were able to host a first event. We had 8 colleges and universities present and some support faculty, and the group was so enthusiastic. Many of the individuals have been doing trauma-informed work on campus for many years. And so our goal is to help accelerate this work where campuses are becoming more resilient, as well as beginning to put it in coursework so that, 5 years, 10 years, 20 years from now, we're not having to go back and train all the teachers, all the doctors, all the business persons, because they have some understanding of what trauma in their staff or what trauma in their consumers looks like. So I'm involved in that work as well as training. As Andi mentioned in her work, on the StrongBrain Institute, she's involved in the group to help to become a trauma-informed institution. I co-chair the committee on developing curriculum and training certificates. And Andi and I were really pleased in December to work with the Quillen College of Medicine and recorded our first certificate program, a 4-hour program that's really a general introduction to trauma, building resilience, the science of ACEs, how trauma impacts brain development, and that's going to be launching very soon. And participants will be able to receive 4 continuing education credits for that. And we're also working to develop sector-specific trainings on education, creating trauma-sensitive schools, trauma-informed policing, and many of these, as over the journey that I've been on around this topic, I've developed trainings that are recognized. The policing training is post-certified in 2 states for officer in-service credit. I also have using a trauma-informed lens in early childhood education that's now recognized by Tennessee Department of Human Services for 5 years as professional development credit for childcare professionals across the state. And so we look forward to offering some of these sector specific through the StrongBrain Institute as well. We also have faith-based training, which Andi mentioned. She's very involved in that sector and helping the faith community to understand that many times trauma survivors turn to the faith community for help and healing and how to better equip them. And then also in healthcare, helping healthcare professionals to understand how that it can be a very triggering setting in healthcare when trauma survivors are patients. So we're excited about offering these trainings and work that is going to continue to grow. One of our StrongBrain Institute members, Dr. Julia Bernard, her department in counseling and human services has already launched a first minor in trauma and resilience. And this is just the tip of the iceberg of where this is going to go.
I wanted to have our contact information up there for you, just so that you, if you want to know more about any of these things, this is available. And now I'd like for Becky to talk a bit about the training that's coming up.
We are going to have a 2-hour training on using a trauma-informed approach in healthcare. It's entitled Resilient Centered Healthcare. And in this educational opportunity, I'm going to share what is trauma, how to identify trauma. As medical professionals, you go through a lot of training on diagnostics, and we want you to see how to identify trauma. What are behaviors that are characteristic or indicated of trauma that it's occurred? We're going to also talk about how trauma derails brain development, which explains some of the behaviors of patients and even of some of our staff, as well as the ACEs study, the Adverse Childhood Experiences study that was conducted in the late 90s that really got the ball rolling on this conversation. And then we're going to talk about what does this look like in a healthcare setting? How can we reduce trauma and not re-traumatize individuals that we serve in a healthcare setting? As I mentioned a minute ago, oftentimes healthcare can be a very triggering setting where individuals are asked to remove clothing, the lights are turned off, and exams can be invasive. And even though those things may still need to occur, by understanding the background of trauma, we can help you to build some skills to better serve trauma survivors that come in to see you as patients. So hope you'll join us for that educational opportunity.
I mentioned also, we've mentioned the faith-based trainings and such a few times, and tomorrow there will also be some information at this lunchtime and then some panels that involve some conversations around faith-based efforts. So join us for that as well. And thank you so much for the time to share this.